We started in 2019 within my family health team in Hamilton, Ontario, and then they have really graciously agreed to support us in opening this up to anyone who's interested in Canada. So we're here to invite you to use any and all of the tools, the slide decks, the videos, anything we've created to share. You know, it's such a new field, and many of us want to do something, and we don't know how to start. So we're all reinventing the wheel. So I think meetings like this really help us to collaborate. And they help us to move from thinking to talking to doing. Tia makes great slides. I hope you can walk away from tonight's talk with at least one new thing that you can do tomorrow. And I would like to ask you a favor. We have quite a few of these talks coming up to Ontario teams, big and small, and you are our first. So I'd love your feedback. And Tia, if you wouldn't mind putting a little link in the chat, and it just has four questions on it that I'm hoping you might be willing to complete as I talk for us to make this better and to create community. So let's start with the big picture. Med school taught us about the broader determinants of health: income, education, language, geography, but really the most fundamental determinant of health, of human and non-human health, is our environment. So going, as you can see on the outside of this slide, we need clean water, food, stable weather, and clean air. And then we healthcare professionals and our hospitals and our clinics there and all the people that we serve, they're all contained within and dependent upon it. So we sometimes think ourselves as separate, but we really are part of the environment, and its well-being is our well-being. And it's getting hotter. So this graph shows the temperature changes in Canada since 2001, with each stripe representing the average temperature for a single year relative to the average temperature over the whole period. So you can see the shades of blue with cooler years, then the red, the hotter years, and then that deep band of red stripes at the far right side showing how we are, our planet is heating up. And the goal has been to limit this to 1.5 degrees, and we've already reached 1.1. So we're likely not going to make that goal of 1.5 by 2040, but by acting now, we can try and limit the warming so we don't go too far over that 1.5. And I'm sure you have all seen in your life and your work that climate change is affecting us. BC with fires and floods, we've had droughts, lots of extreme weather events, tick-borne illnesses. We're getting a lot more of those in Ontario, and food security issues, especially in the north. And in Canada, all of us in healthcare, we contribute to those emissions. So about 5%. Comes of all of our Canada's emissions come from healthcare. And that puts our healthcare system almost the worst in terms of greenhouse gas emissions per capita in the world, compared only to our neighbors to the south. So we are the red line just underneath their blue line. So the Lancet Commission on Climate Change has identified it as both the greatest global health threat, but it's also an opportunity. And our Green Initiative really tries to make sure we include that opportunity aspect, because we really have an opportunity to help the health of both the environment and humans when we do this work, because there's so many co-benefits: food security, healthy cities, mental health, disease prevention. So by doing this work, not only can we reduce that 5%, but I'll hope that by joining it, we can improve overall health even more than that. This improvement has actually been studied in a recent paper from the UK. It shows that when we work to reduce environmental impact, it's predicted to have a substantially positive benefit on human health, with many years of life saved. This is a study from England and Wales alone, showing how many million life years are gained when we work on environmental initiatives. So there are so many different ways to tackle climate change. There is voting, there's what you purchase, how you heat your homes, the crops that you grow. So it's kind of overwhelming. And I started off on this journey quite recently in 2019, similar to you guys when I heard a talk. And, so grateful to people who did that. And I went out with some non-medical friends afterwards, and we started thinking, okay, how can I reduce my carbon footprint? And then I thought, I'm going to have a much larger impact if I do this in my workplace. And I'm sure all of us in primary care understand the pitfalls of trying to be a specialist in every area, as we so often are asked to be. So the area we decided to focus on in this was really the area that we know the most about, which is primary care. And that's me examining the cutest little baby. And we divided it into two sections. So the care and then the offices that we provided in. And between those two areas, our offices and our care, the data really supports emphasizing that we should start with our care because it has the greatest potential for a positive impact on the environment. Because if you look at this bar graph of emissions, you can see that pharmaceuticals, including metered dose inhalers and acetic gases, really are much larger footprint than the energy, water, waste of our offices. So when starting out, I think a lot of us, and myself as well, thought, okay, I prioritize what I see, and what I'm seeing is garbage. And so I think this work should be about recycling. But unfortunately, that doesn't really change much. Only around 10% of our product's emissions, because 90% of it comes much further upstream. But if we look underneath that garbage, underneath it is the visible garbage is the invisible part of the iceberg, which has a much more powerful effect on the environment. And it actually is something that primary care is particularly good at. So we developed these initiatives around the 6 aspects of our care. And then we also documented the progress that we made in the 2 categories of our office infrastructure. So for our care-based topics, we focus on initiatives that have co-benefits for our patients and the planet, and we call this high-quality, low-carbon care. And these are initiatives that we can engage our patients with solely because it benefits their individual health. And after all, that's what we're all about. I mean, I've been doing this for a couple of years, and I can count probably on one hand how many times I go further into saying why it's better for the environment, because I don't need to, because it's better for their health. It's a central part of what my conversation is my individual patient's healthcare. I'm going to quickly go through our topics and the resources we have. So first of all, metered dose inhalers. So it is good care because it's a great opportunity. So we include this in our project because one puffer, a metered dose inhaler puffer of 100 doses, has the carbon emission equivalent of about a 290 kilometer car journey. So that's why it's in this project. But it's high quality care because, so there's 3 areas. One is that many people get a diagnosis of asthma and COPD that have never had spirometry. So about 44% of asthmatics have never had spirometry, and 67% of COPD have never had spirometry. So there's a problem with overdiagnosis. And I have de-diagnosed quite a few people since starting to do this. In addition, there's some great evidence that we should be using PRN budesonide formoterol, which is a dry powdered inhaler, because that decreases exacerbations compared to PRN use of short-acting beta agonist, which is an MDI. And then lastly, there's an opportunity to improve our inhaler techniques, because studies show that various studies, up to about 70% of people aren't using them correctly. So those 3 areas alone are a really good reason to try and take a closer look at metered dose inhalers. And it's low carbon care because, and as we were just on a talk, we were just talking to our, we call it the physicians who are in our little local group. And one of them just said, they're just using less inhalers because there's less diagnosis and they're better treated. So they're using less inhalers overall. So the hydrofluorocarbon propellant in the metered dose inhaler can be up to 3,000 times more potent than the greenhouse gas emissions of carbon dioxide. So in the UK, they estimate that to be about 3% of all of the National Health Service's carbon footprint. And you would not believe how many are dispensed in Canada every month, you guys. 900,000 salbutamol alone every month are dispensed in Canada. So it's a lot of emissions. So with each initiative, I'm going to show you the tools. So with the goal that if there is one that's compelling for you, you can log into our website and please use it. So starting clockwise at the top, we have a webinar that we taped. It's probably about 25, 30 minutes that you can listen to, and then we have an evidence-based infographic. We have a patient-facing poster. Does your inhaler look like this? Let's talk. We have an EMR search for Oscar and TELUS, and I think 2 other EMRs. So if you want to do a QI project and do a measurement before and after. And then we less applicable, but we have a puffer sample package for local people. And we have a little cheat sheet that you can use showing which inhaler has which carbon footprint. Okay, our second green care topic we call plant-rich eating. We avoid saying plant-based because we want to be inclusive of many different eating styles with the motto, progress, not perfection. And it is high quality care because this style of eating has really a phenomenal amount of really strong evidence-based benefits. So cardiovascular with a 25% reduction in ischemic heart disease. Decreased angina symptoms, decreased systolic blood pressure. One of the physicians that I just talked to today has gone plant-rich and his systolic blood pressure has gone down by 15. Diabetes, reducing, it can enable patients to go off 2 diabetes medications. And some cancer prevention, mental health, liver, kidney health, bones. I can't tell you how many people I see from constipation, heartburn, bloating, diarrhea. A lot of your day is that, and it can really help with all those things. And of course, it's low carbon care twofold. One is it reduces healthcare's carbon footprint because it alleviates all those diseases. And secondly, it reduces animal agriculture, which is responsible for almost 15% of climate change. Now, how can we do this in the midst of our busy clinical day? So this topic just really took off. So here's all of our tools. So starting at the top at 1 o'clock, what's for dinner? That's a patient-facing video you can show in your waiting room that we made. Next is our webinar that you can watch. The next at the bottom at about 4 o'clock is a educational group that anybody in Canada can self-refer to and attend, and it's led by a registered dietitian. And I am entirely grateful to my family health team for this really generous offering. And Tia, I guess you could put a link in the chat for the plant-rich general section on our website. So patients self-refer, they don't need a referral from you. They can refer via email or which is easier if you're calling from BC. It's 2 sessions, each an hour and a half long, and it runs every month. Then there's a poster and the 2 reference guides. This is what I use when I'm talking to a patient because I can't remember what the benefit is for all the different, how much does it take down your heart disease and how much does it take down your diabetes and how much does it take down your blood pressure. So all those stats are on there along with some quick nutritional considerations. Then there's a poster at the far left. So the way I use that poster is I wheel my chair over and I say, it's a Canada's food guide. And I say, here's all the benefits. And I try and pick the one that they're in to see me. And then I cover the plate and say, you should have half fruits and vegetables, 1/4 whole grains, and 1/4 protein, and mostly plants. And then I say, and if you're interested in more, take a picture of that plant-rich eating group poster and sign up. So then we have an EMR embedded Plant RX. So you can put your patient's name on it. It has a bunch of references on it. And then, of course, we always have our an infographic that is really all the evidence-based literature on it. So then the topic we launched last fall was disease prevention, which improves human health through early detection and prevention and less intensive treatments. And it combats climate change by decreasing the intensity of healthcare required and therefore the effect on its environment. We include a smoking cessation, which has a fairly large carbon footprint to produce and disseminate tobacco. So we have a recording, the tools for that is we have a recording of the webinar, and then we have a blog for cancer screening that has all the sort of ins and outs of our cancer screening. It's mostly Ontario-centric, I think. And then our current focus is on prescribing. And I think Ilona is going to talk a little bit about testing too, and maybe delve into prescribing. When we are mindful of how we prescribe, we can improve the health of our patients directly. We can reduce unnecessary side effects, drug interactions, costs. We can motivate them instead to choose healthier lifestyles that often have equally efficacious effects. I put the Choosing Wisely logo here because one of the medications we're going to talk about is supported by the Choosing Wisely campaign. So our webinar on this is coming up. We really try and make them practical and primary care focused. We're going to demonstrate some shared decision-making tools for bisphosphonates and statins. I've been using those both for about a year, and patients are choosing less medications, fully informed, choosing less medications. We're going to talk about terms like deprescribing and prescribing cascade. What clinical presentation should should make you think, this could be medications. And then we're going to take a deeper dive into statins, bisphosphonates, SSRIs, PPIs, and salbutamol with some practical suggestions. It is low carbon care because prescribing is our most important topic. Our pharmaceuticals is the highest source of carbon in the healthcare system, even more than hospitals, which is surprising. So this is the invite to the webinar. I don't think it's ideal for you guys because of the time. It'll end up being 9 in the morning and 5 in the afternoon, but we will record it and put it on our website. It's multidisciplinary, so it's for anyone who prescribes, discusses, recommends, reviews, or QI team people. It's an hour long. It's accredited for 3 main pro. And it's very, very interactive. And I think we're all thinking along the same lines, because Ilona, you can put in a link for your webinar too, because you're having one coming up with the Therapeutics Collaborative on March 15th, which would be great. I think Tia, I might have given you the link to that one as well. You could put that in the chat. Okay, our last topic will be nature, and BC Parks with your very own Dr. Melissa Lem has a wonderful program called ParkRx, prescribing nature for its health benefits, especially mental health, and then that leads to more pro-environmental behaviors. And this is the wonderful poster on the far left that they created. It's a beautiful poster. And then we also made a waiting room video for patients to be motivated to get out into nature that has a second, and then we created a EMR embedded ParkRx. It's the ParkRx one, and then it has a second page on it that just lists all the benefits for people. And then we have the our usual infographic that has all the evidence-based. So those are the initiatives in the green care category. So I'm going to quickly do a quick zip through the green office, reducing waste and emissions. So all of the tools come from the experience with my own office of 4 docs, 4 admin, 4 nurses, and 4 allied healthcare professionals. For this part, we use the Canadian Association of Physicians for the Environment's Green Office Toolkit and some other resources. And we made the changes in our office, and then we measured it to see what the impact would be on our staff, like how difficult was it to do, our pocketbooks, how expensive was it, and then the environmental benefits. So how many kilograms of waste, or how much less heat did we use? And there's just a whole list of waste topics. Printing paper, our coffee, our tea, we were using Keurigs, which is terrible. How we disinfect, exam paper, how we sterilize, how we serve water at meetings, toilet paper, paper towels. And then we did the emissions as well. So we put in LED lights, promoted active transport, talked about how and when we would safely use virtual visits, turned down our water, figured out our heat flow. When we did the LED lights, we saved about $5,000 over a couple of years. And when we did the paper, we saved about 3 kilometers of exam bed paper. Paper towel was our biggest waste source. So we diverted 170 kilograms. And the exam bed paper, the LED lights, and then we turn our water has gone down by about 50%. The confounding factor is the pandemic happened just after that. So it's hard to measure this stuff. Each of these specific initiatives has an infographic. So we provide very practical tips about how to make these changes. It's really hard enough to get through our busy clinical days, let alone try to find the printing paper that has the most recycled content that works well in our printer. So we get very specific in these infographics. So those are the various green care and green office topics that we came up with, and how do we support them? I'm just going to go over a few things that are on our website. There's a worksheet that people can use to track their progress. There's posters that you can order. We've had almost 1,300 ordered so far. And again, my family health team, if you order them, I think the big orders, they say, no, you need to print your own PDFs because they're all on the website, but for smaller orders, they're still willing. We have the webinars that I talked about. And we really like to be multidisciplinary. So we've had lots of family doctors come, but then lots of other healthcare professionals. We've got a newsletter that we use to create community, to celebrate successes, to invite partnerships. And that's on the link that Tia's put in the beginning. If you want to give us your email address, we would love to have the BC folks join our newsletter. All of the back issues of the newsletter on the website, and everything I've talked about is all on the website. And then we do report to a QI committee. So you may find, like us, that when you do this work, it's hard to measure carbon reduction. So instead we measure engagement. So like the poster orders and the webinar attendees and how many green teams that we've mentored. And we measure geographical spread. So we're happy to have really lots in Ontario of the various family health teams, and some nurse practitioner-led clinics, and some of our larger teams, which are called Ontario Health Teams, and then some across Canada. So I'm just going to end with some rapid fire reflections from the last 2.5 years. I think we got the support of our organization and the interest because we really focus on initiatives that improved our care. So they just happen to reduce our carbon, but they really are fundamentally important for our patients' health. And within that, we tried to choose projects that would have a large impact. So for example, like pharmaceuticals and meter dose inhalers and plant-rich eating. We tried to make it easy. So you take the exam bed paper off and you get all those questions from people. So you just put that poster on the bed and it explains what you're doing. And our motto is to pursue progress, not perfection. Plant-rich eating is a good idea, a good example of that. So no judgment, no judgment. We tried to engage other organizations. So because together we are stronger. We really tried to celebrate. So this is a plaque for offices in our area that do a certain number of things. They get to get their own logos. This is a unicorn and a rainbow that they picked. And if they get this artist plaque. I like this saying, lift from where you stand. So we really thought about, what are you good at? What do you enjoy doing? Where are you influential? And that's probably where you can be successful. So that's why we really ground this project in primary care. And think about top down and bottom up approaches. Ours really could not have started more bottom up. We put on our boots, a tarp, and we weighed some garbage. So we started bottom up, but it really gave us the credibility to enable some real progress. And we have been influential from those trenches because both our family health team, these are the two strategic plans. So our family health team and then our larger parent organization, which is our Ontario Health Team, they have both embedded environmental sustainability within their org structures. So now each of them now has responsibility to enact them and to measure them. And that leads to resources that they have to devote to it. And the most important resource is people. So here's some of our people. So that's Tia and I on the left. And when you do your project, you keep on doing your project because you're already there, people will join you. All sorts of people with all sorts of talents. So our QI people and our communications people and physicians are interested. Now they all had to be asked individually, but we call them the gardeners. These are the call group leads. And I just met with them tonight, and it's really helpful to be doing this with other people who are keen about it. I think almost a quarter of them now have gone plant-based, plant-rich. We kept the project open to the whole team, so definitely not just physicians. This was the Puffer project, and we had respiratory therapists and pharmacists. There's really lots of opportunities to learn from each other. And this is the plant-rich team. So we had a registered dietitian who's been phenomenal. She's the one who leads those groups, and then another physician. And then the teams in our office are so important. So how can we get staff to buy in? Start where they're interested in, put it on the agenda. We had some students that we hired. We got some grants. We went slow because we're just mostly about trying to manage our basic day. Always bring food. Always bring food. And then we had a little logo where we designed this little bee. CP Humblebee. He's not a he. They, because they're a non-binary bee. So CP Humblebee is our logo for when we put up posters and stuff in the office. Tap into the strengths of those around you. This is Kira, who I worked with for years. I had no idea that she was so into recycling. Have leadership, so someone who really can keep the ball rolling, and leadership involves often the someone who is a clinician and then project management. So none of this would be possible without Tia's project support. Have some fun. This is our executive director who made a hilarious video about biking to work. Ask your friends. This is my friend Diane, not a doctor, but she owns the Eastside Mario's and she knows where to buy stuff. We had someone who wrote the videos. A friend of mine's a playwright. We have someone who knows, a friend of mine who knows everything about light bulbs. So she helped us find the LED bulbs. Ask your family. These are my daughters. They have been super helpful with, there's one installing the light bulbs. And then celebrate together. This is our first and now our annual Beers at Brian's event. We had a great plant-rich food and some local craft beer and cider, and we just hung out in his backyard. So really, there's lots of reasons to get involved in the sustainability work, your family, your patients, to learn, to support equity, to protect nature, for your team dynamics at your office, and for the health of your office. These are my two biggest motivations. They're my daughters. And when I learned about the risks in their lives for climate change, I really felt compelled to take action. And when I had the knowledge about climate change and then I started to take action, it gave me this wonderful thing called hope, because climate action is the best treatment for climate despair. So let's all start and grow. Start small, grow, do one thing, gather like-minded people around you. Because as Margaret Mead says, you can never doubt that a small group of thoughtful, committed citizens can change the world, because indeed it's the only thing that ever has. So thank you all for listening. We would encourage you all to stay in touch with your Ontario Canadian neighbors. And we can start, instead of all reinventing this wheel, we can roll it all together. So thanks, everybody.